Good evening and welcome to this informative and interactive live session created to empower moms to spot common baby skin issues like dry patches, flakes, rashes, and more. Babies' delicate skin often shows rough patches, peeling, redness, or irritation due to developing barriers, weather changes, harsh products, or irritants. Early identification prevents discomfort and supports healthy skin. In this session, learn practical ways to recognize symptoms, build pH 5.5, and know when to seek medical help. We are privileged to have Dr. Manisha PH with us in this session. Dr. Manisha, thank you for joining us today.
Hello
Dr.
everyone.
Manisha, hi. Hi, Dr. Manisha. Thank you for joining us today. Dr. Manisha is an experienced pediatrician and neonatologist with 23 years of practice based at Ovum Hospitals, Banashankari in Bangalore. She specializes in child health, offering expert care for infants and children, and has shared professional insights on developmental topics such as child screen time. Dr. Manisha, we would love for you to share your thoughts on today's topic, which is spotting skin issues.
Yeah, hello everyone, and a very good afternoon to start with. In the pediatric population, in the OPD practices, now we see a lot of parents coming to us with the skin problems, which starts from the newborn skin to the pediatric age group and which continues till about adolescence. And the usage of now the cosmetic and the childcare products for the skin has increased a lot over last decade, I would say, beginning from the neonatal period till about adolescence. And the newborn skin is extremely sensitive because of the skin immaturity and the availability of the products in the markets, which includes from the traditional herbal oils to the cleansers to the moisturizers, and the list goes on and on. So the today's topic is very apt because it is for the mom's guide, because we have a lot of confusions about what to use and what not to use, and particularly giving the insight on the dry skin which generally happens during the winter season in Bangalore or all across Indian states. So how to deal with that, and whether it is pathological or it is physiological, and how to treat it, and what are the products available which are safe and unsafe, and what to look at the labels. So I think this 1 hour or 45-minute session will give you the answers for most of the common questions which we get during our OPD hours. So thank you for having me. We can kickstart the session.
Thank you, Dr. Manisha. Before we continue, Dr. Manisha will answer your live questions for informed skincare decisions. Let's begin with the first question, Dr. Manisha. Why do babies get dry patches and flakes on their skin?
So, it also depends. First, you have to understand is how the pediatric skin differs from the adult skin. The pediatric skin or the newborn skin is very different in compared to structure or its function or its composition and its permeability. That's what we call it as it's a leaky skin. And the absorption is also very good in for the topical agents, but at the same time the transepidermal water loss, even the evaporation from the skin is also very high. So it's a very immature skin which can lead to evaporation. We call it in medical terminology transepidermal water loss, can lead to help in thermoregulation, the temperature maintaining, because if there's a lot of water loss, it can cause dehydration. And skin is the most vital organ, which is the longest organ of our body. And if there is this dysregulation in this, they can get dry skin. Also, there are some pathological conditions like atopic dermatitis, which we see in winter season, sometimes because of the environmental also exposure of allergens, and it's a inflammatory conditions which can lead to a dry skin. Generally, it gets better as the child grows. But what we have to understand is the infant skin is very, very vulnerable because of the skin immaturity.
Okay, Dr. Manisha, are there any visual changes that can help moms differentiate between, say, normal dryness, rashes, and eczema?
Yeah, so generally the location of the eczema is what you have to see. You never get eczema in the groins or in the axilla or the intertriginous areas. You get eczema most commonly, you will see children with the red cheeks, you know. You will see it on the hands, you can see it on the legs, you know, on the shin, and sometimes on the back. So it starts with the dry skin, but then it gets into the flakes, you know, it gets into the flakes and you get sometimes redness. In the severe cases, they break open the skin barrier, it can bleed. So anything to start with dryness, we all know that we have to put moisturizer. But even after using the moisturizers on a daily basis, if you see the dryness remains, it's always, or there are blister formations, then it is always better to take an opinion of a pediatrician or a dermatologist.
All right. Thank you for that information. It's been really helpful. Before we move forward, I would encourage all parents to share their questions in the comments below. We will try to take as many as possible during this session. Moving on to my next question, Dr. Manisha. Um, what changes happen in the environment, or can daily habits trigger rashes as well?
See, daily habits in newborn period, it may not be much, visible or evident. But in newborn, what I would say is which can trigger. You are asking the dryness, right?
Yeah.
Can I have the question again, please?
Yeah. What happens in the environment, what changes in the environment can trigger the rashes, and also what kind of daily habits can trigger those rashes?
So, see, environmental changes, something we call in the allergen exposure, we call as modifiable factors. Something is non-modifiable factors. So, in environmental changes, the non-modifiable factors which are not in our hand is like weather change, any extreme dryness in the weather, any season change for that matter. And especially as you see the Bangalore weather, which has got very less humidity, as we are not a coastal city, we do not have the humidification. The relative humidity of the air is very low, which is not there in the coastal areas. So these are environmental factors. The other factors are like dust, or there is a pollution, or there is pollen. These are all allergic sensitizations. So these are non-modifiable factors which we may not be able to do much about it than just protecting our child or a newborn child, not taking them out in first few months of life. In the modifiable factors, we can think about, to prevent the dryness, in this usage of the cloth which you are using. So the cloth which you are using should not be having lot of fragrances, or should not be washed with a strong detergent, because that is what your child is wearing for a long period of time, your newborn is wearing. And also about what products you are using for the skin. So we say that first 28 days is the time where the skin is very very immature. So that time we should use dermatologically tested, clinically tested labels. So only those. We tend to use many of these herbal preparations like oils, castor oils, mustard oils, gram flours. So even these ones, which has got traditional, roots, and which kind of continues in the family for the longest generation wise, so they also can, these practices, we do not have a evidence based safety profile for those. So those also can cause, the dryness and this. So these are all the modifiable factors. The non modifiable, the environmental, we may not be able to do much about it.
Right. Is there a correct or a right pH for a baby's skin, do you think, Dr. Manisha?
See, when the newborn is born, the pH, they are covered with something called as a very white cover. If you've seen a white jelly-like substance, which is called as vernix caseosa. So when that is there, that time the pH of the baby is about 7. It's an alkaline pH. But quickly it drops down to the ideal pH, which is 5.5. Now, this pH is a acidic pH, which is a good acidic pH is required for the babies to prevent any infection. It kind of forms a barrier, kind of a mantle it forms so that there is no penetration of the bacteria, and it helps the babies from any allergic sensitization. So even if we use any products, it's ideal to check these products with the pH of 5.5. So that is very important. That's a point to be taken, or when you say a key message, a take home message is whenever you are choosing a product, choose a product which has an ideal pH of 5.5,
You
because
said,
that is what
yeah,
helps in skin maturation.
okay. You also said that pH 5.5 builds a barrier on the baby's skin, thus protecting the baby from infections. Does that also include from rashes and from flaking?
Yes, because that is how it prevents the dryness. See, a acidic mantle will keep the natural oils there. It doesn't strip away those oils. So eventually it will help the baby from the dryness and the flaky skin.
Okay, Dr. Manisha, are there also any specific habits you think that parents or routines that parents might be following on a day to day basis without even realizing it, causing their children or causing their babies to get dryness and rashes?
See, few things is one is giving baths. When people give baths before that they apply the oil and then give the bath. So what will happen that it strips away the oil. We call it as a 3 minute rule, where after the bath the skin pores open. So the best thing is after the bath, within 3 minutes, when you wipe the baby and apply the moisturizer or any cream with kind of a pH of 5.5, that's the time it is best absorbed. So there's too much of drying of the babies and keeping the babies open and then putting the oil, covering the baby. So all these things has to happen within 3 minutes, because that's the time we call it as a golden period where the maximum absorption of these creams or the moisturizers or cleansers which you're using, which will help the baby prevent dryness. So this is something the parents have to take care important about. And first 24 hours we do not give baths to the baby, and after that also it's not necessary to give bath every day. If it's a winter season, you can just sponge bath them. So because too much of overwashing strips away the oil. So that is very important. The parents should follow. I feel that that 3 minute rule is something which I want to emphasize on.
Okay, and also since we're talking about bath time, is of course because temperatures have dropped throughout the country at this point, it's colder. Do you think hot water, using hot water or warmer water than normal water, does that strip the skin of essential oils? And
So
also,
very
does using indoor heaters also affect the
So,
child's?
the temperature, when we say give bath, in Kannada we say kai beccha niru. It is that lukewarm water, that it should not feel very hot. We tend to, in South India, tend to give bath with very hot water, and that makes the baby more hypothermic, and it just takes away all the oil and damages the lipid matrix, of the newborn skin. So it's important that we use a lukewarm water, a quick bath, a 3 minute dryness, and then apply the moisturizer. In the winter season, we can give bath, maybe a sponge bath, maybe about twice or thrice in a week. In a summer season, which will start from March, you can give bath either alternate day or every day, depending upon which part of the country you are staying in. Head bath, I would suggest maybe only twice a week.
Okay, and I'm going to stay on this topic of bathing since it's a crucial part of a baby's routine and of course a parent's routine as well. Um, how important is it to use a gentle cleanser while giving your baby a bath?
Yeah, so gentle cleanser with a pH of 5.5 is a very safe, because we look at the child products with the dermatologically tested safety profile. And general, the basic guideline is minimal intervention. that you don't have to really use many things. You can use a gentle cleanser, give a small, not too much of washing, give a gently clean, so minimally intervene, minimal bath, but a quick bath you have to give, because this pH of 5.5 with a gentle cleanser is going to restore your skin, calm the inflammation, and the lipid matrix, what we call in the newborn skin, is very immature. Okay, so lipid is the one which kind of maintains the skin barrier. We call it as it's like a brick wall. Skin of the newborn skin is like a brick, you see, and there are skin cells are called as corneocytes. The interlocking between the skin is not very well maintained in the newborn skin. So here the gentle cleansing matters a lot, because if we use a product which has got larger molecules, they can penetrate through the skin, and they can cause the allergic sensitization, and this can have a long term impact for the allergy development. So minimal intervention, gentle cleansing, a quick bath.
Thank you, Dr. Manisha. Before we move on to the next set of questions, I'm just going to take a couple of questions from our viewers. The first one is, how can I tell if a dry patch is normal or something I should worry about? This question comes from Anita.
Yeah, so the dry patch, whenever it is during the winter season or dry season, if it is a small patch which is not going after 1 week of applying a moisturizer, one thing. See, if it's after applying moisturizer, you feel it is getting better, maybe you can continue apply that. But even after 1 week, it remains the same, or it is circumscribed. Circumscribed, it has well marked areas. If there is a redness, and there is itching, the child is continuously itching that area. So if we call it as itch scratch itch cycle, the more the child itches, the more the skin breaks down, it scratches, again there is a itch, may not settle with the normal moisturizer. So you can try it for 1 week. If it doesn't settle, one. Second thing, if there is marked redness, if there's a redness, there's a circumscribed area, and child is continuously scratching that area. Two, then you have to visit. Third, if there are blister formations, please do not wait. Please come. And there is a oozing. There is some secretions which are coming out from that dry patches only, I'm telling. Okay, third. And fourth thing is, the dry patches which causes bleeding. Sometimes, it becomes blackish and causes bleeding. So those things you have to come back to the doctor. So first, dry skin exposure, you may not suddenly jump and go to the pediatrician or dermatologist. Try use good cream with, as I told you, clinically tested, dermatologically labeled, with the proper, fragrance free, and with the basic petroleum you can use. It's the safest one. If you do not have any, so petroleum is the safest with the long term safety profile. Use it for a week or 10 days. If it doesn't settle, it's better to show, because we need the diagnosis. See, you may think it is a dry patch. I may think it is eczema. I may think it's a fungal infection. We have to make a diagnosis of that patch. Once the diagnosis is dry patch with eczema, then okay, we can treat it. But to confirm the diagnosis, it's always better to visit the doctor.
Okay, it's interesting that you mentioned eczema, because one of our next questions is related to it. Uh, Priya asks, "How can I identify early signs of eczema at home?" And I also think I'm gonna bring in another question here, because I think it's related to this. Sunita asks, "Is flaking on the scalp or eyebrows normal in young babies?"
So I'll ask the first question, that how do you identify the early signs of eczema? So see, eczema also run in families. It has got a little bit of genetic predisposition as well. If you ask me what is eczema, basically in our language we call it as atopic dermatitis. So which has got a allergic tendency. The child has got allergic tendency, and that's why it's a skin condition. It is similar to what we call as respiratory hyperreactive airway disease, but or allergic rhinitis. Like that, the skin condition is an inflammatory condition, and it's a pruritic condition. So what you have to understand is eczema is pruritic, it is inflammatory, it generally runs in families, not necessarily, but do have a genetic predisposition. It's an immunological problem. If I have to say you in a medical language, it causes increase in the IgE. It is basically an allergic, antibody which is raised in the people with eczema. So if you have to identify, you have to see the first the location where it is. It is commonly seen on the cheeks. You never get eczema. Very unlikely to get eczema in the groins, in the axilla, behind the ears, or in the intertriginous areas where there is a fold. You get or below the nape of the neck. You don't get eczema. Generally, it's on the cheeks. You get it on the back. You get it on the elbow. You get it on the legs. So your palms, soles also is not up. So the sign is the first location where you're getting. Okay. Second thing, only during the winter season it's getting better. Okay, eczema generally tends to remain, because it's a dry skin, and it is because it's an allergic thing which is predisposed to genetic predisposition. It may not be seasonal. You may get it also in the summer season. It continues to be there. The skin remains to be like this, unless you treat it. It is not going to go away. If it's a dry skin, generally when the weather changes, gets better, it may get better. Eczema do not tend to get better like this, So there is a difference between dry skin. So eczema also presents with dry skin, but the dry skin also can happen in the dry weather because of the less hydration also. So eczema is a genetic chronic inflammatory skin condition. So it doesn't go away by itself. It's a mild eczema, will get better with only moisturizer, but moderate to severe eczema needs, more treatment along with the creams and moisturizers, the medically, proved creams. So the location, very important, whether it gets better over time, if you have a genetic predisposition, if it remains and it has got itching, as I say, itch, scratch, itch cycle. So if it keeps happening, and definitely blistering, oozing, redness, bleeding, please come back. It can't be only dry skin.
Thank you, Dr. Manisha. That was really
The
detailed.
second
And
question,
yeah,
what was it? I forgot.
so
Okay,
I
she
think this
asked
was
about the
really good.
scalp. Yeah.
Yeah.
So there is one condition what we call it as cradle crack. Okay, it is in our medical language we call it as seborrheic dermatitis. So it is not associated with eczema. It's basically the scalp which gets deposited. You can say blackish scalp which is seen on the top of the scalp. So that is commonly seen in children. I wouldn't say it's normal, but it's a common physiological finding seen in the newborn babies. So generally what we tell them is to apply oil at night and use a soft brush, a toothbrush which we use, a soft one, and gently you can just, gently comb. So over the maybe the 7 to 10 days, the flakes start falling down. So it is because of the dry skin only, but it may not be eczema. It can be seborrheic dermatitis. Okay. So what you have to understand is the sebaceous gland is the one which causes the seborrheic dermatitis. That activity is increased in the newborn period. That is because of the maternal hormonal exposure in the child. It gets better as the child grows, but that is seborrheic gland activity is increased in the newborn period. But at the same time, sweat gland activity is not that developed. So because of that, they may get this seborrheic dermatitis. The flakes which are coming on the eyebrows, sometimes you get it on this, can be a part of dry skin as well as eczema as well.
Okay. All right, I'm just going to move back to some of our questions from earlier. We were talking about a bath, and I'm going to move to the post bath routine for babies. How important is it, or what is the right way to moisturize post bath, and how often should parents reapply a moisturizer, especially for flaky skin?
So, as I told you, the after the bath, it is important to apply the moisturizer within the 3 to 5 minutes window period, because that is the time your skin pores are open. So please
Yeah.
apply it. After that, quickly you have to dry the baby, then apply the moisturizer, and then I'm talking about a newborn skin, a neonate, a baby when is born within 3 months, we cover them. In a newborn period, we cover them with three-layered clothing. And once maybe they get better, maybe about two-layered clothing to keep that warmth and the oil, remain with the child. And if you see the dry, flaky skin in eczema, in case you can apply the moisturizer as many times as required. There is no such thing that you can apply only once or twice because it gets dried faster. If you apply any oil to the newborn skin, you'll see after 1 hour there'll be no oil on the skin. It gets absorbed very well because they have called as something called as leaky skin. They have something called as transepidermal barrier, so they get absorbed very well. So that's also one way to keep them warm. That's why we, in the traditional practices, we do tell to apply coconut oil because that is the one which has got medium chain triglycerides which gets absorbed in the skin. So that is the one thing, but no castor oil, no mustard oil, because don't have that much safety profile. So as I told you about the petroleum jelly, like that, the coconut oil you can apply, but you have to apply it as many times as possible. Coconut oil we may tell maybe about twice a day after the bath, before sleeping. If you ask me about the creams, these creams get absorbed as early as about 1 to 2 hours, so you can may apply about 4 times a day.
Okay. In the interest of
Especially if you
time,
are taking the baby out, you have to apply before. After bath, yes. Before sleeping, yes, because it will have a long term, effect. So the baby will be sleeping for 8 hours. So if you're taking the baby out, please apply because then you are exposing the baby to the environmental allergens. So these are
right.
specific conditions where you will apply always.
Right. All right, Dr. Manisha, in the interest of time, I'm just going to skip to some more of our viewers' questions. We have one from Rekha, and Rekha asks, what ingredients are safe for newborn skin? Are there any specific ingredients you think?
Yeah, so the ingredients which are safe, there are which are harmful, which are safe. So, in terms of traditionally thing, if I tell you, it is the coconut oil. Petroleum has a long safety profile. Glycerin, if you know, because glycerin retains the moisture. So these things traditionally which you can apply to the baby. If you are seeing what is safe for the baby is something or creams or the lotions which are fragrance free. We look, no, don't look for unscented. We do not, even if the natural scents like lavender or the tea tree oil we have seen, they can give rise to irritation. So no fragrance is better. Minimal intervention. Skin pH of one which maintains about 5.5. That is the one. These are all the safe ones. So mineral oil, I'll tell you, zinc oxide. If you want me particularly to name any few ingredients, it is zinc oxide, basically used for the diaper dermatitis. It is the mineral oil derivatives. Second is titanium dioxide. So titanium dioxide and zinc oxide are very safe in children. They are tested and have the long history in pediatric population of the safety profiles. So zinc oxide, titanium dioxides, ceramides. Ceramides are safe because ceramides are the ones which maintain that lipid barrier, the lipid matrix which I am talking of the skin. So those are, so if you're looking at the ingredients, look at ceramides, look at pH of 5.5, look at zinc oxide, look at titanium dioxide. These are petroleum, glycerin, they're all safe. When I'm talking about safe, let me also tell about harmful things. So if these things are there, you can always not always keep it back on the shelf. So these are, one is paraben. Paraben is FDA not approved product. Okay, so please, paraben, no, not to be used to anything. Second one is any sulfates, anything sodium sulfate ingredients to be. I don't want to get into the particular molecule, but sulfates. Second is phthalates. Phthalate starts from P, PTH. It is phthalate. Okay, so phthalates, sulfates, parabens. Then there is one ingredient like triclosan. Now, this triclosan is present in the antibacterial, so-called antibacterial soaps, which I have seen few of the parents are using for their children because the child has a skin rash. Skin rash is not infectious, and they use antibacterial soap which contains triclosan. So triclosan is again not recommended. Paraben is not recommended, triclosan not recommended, anything with phthalates, anything with sulfates. Please do not use it. Anything which is with petroleum, glycerin, ceramides, fatty acids, zinc oxide, titanium dioxide. These are all safe ingredients which are tested and pH of 5.5. Always keep it in mind. A pH which does not give lather. The more the lather, the more alkaline is the
Yeah.
pH.
Yeah. Uh, Dr. Manisha, also I want to ask you, are there any specific areas of the baby's body that need more protection as compared to the rest,
Yeah. So
especially?
specific. Yeah, so newborn skin itself is extremely immature. If the one which are exposed areas, those are the ones which need more, protection. So because after about 4 to 5 months, when you take the child out, the face, because that is exposed, you can't cover the face completely. Exposed areas, hands, exposed areas like legs and back and the buttocks, because buttocks in children, because of the loose motions or because of the diaper dermatitis, they are very, very prone to the skin issues. They get redness, they get moisture, and so those areas, but exposed areas, bumps and buttocks, I would say, is something which requires real behind the ears. I've seen sometimes you can see rashes behind the ears, and if the child is chubby, sometimes below the neck, because of the folds. They have these folds, in between the folds, although the child gets the skinny rashes.
Okay, and is there specific care, or can the skincare routine of a baby change if the baby has sensitive skin?
Yeah, the skincare routine has to be doubled up, So whatever you are doing, you may have to do it round the clock with the, particularly if we are telling you you have to do it about 4 times a day, you may have to do it 4 times a day. So it kind of increases. It requires more, your attention in case the child has a flaky skin or a eczema.
So compared to, of course, since we're talking about babies, when you compare newborns to, let's say, older infants, do you think there's a different approach when it comes to skin issues?
Definitely, yes. As I said, the infancy and the newborn period, first 28 days is very sensitive. So we generally tell first 28 days minimal intervention. After 28 days till about 1 year, the 1 year, what generally is used in the newborns, because their skin immaturity is lot. As I said to you, there are a lot of leaky skin. So trans epidermal water loss is high. They have thermoregulation problems, so it's important that you keep the baby warm. The kind of products which you use for a newborn is also different from a pediatric age group. Pediatric comes with the little cosmetic products. In the newborn age group, it is more, as I told you, maybe about oils, about diaper rash creams, about cleansers, about moisturizers. So these are the mainly, or shampoo. Okay, shampoos. This is what we use. Talcum powder is something which we discourage. We do not, encourage usage of talcum powder because it's a dust, right? So there is a chance of inhalation risk, and sometimes it is also known to affect the endocrine, barriers. So we do not encourage talcum powders in any age group, for that matter, not in a newborn and a pediatric. Once you come to infancy, the infancy, or I would say more of a pediatric age group, the pediatric age group becomes more in terms of moisturizers, creams, shampoos, the fragrance, maybe cosmetic dermatology comes more in picture, sunscreen, because it becomes more important. And if you ask me the recommended age, I would say maybe after 6 months, when the child goes outdoor, during the peak, 12 to 3 times, generally it is recommended that we can use a minimal sunscreen. Again, I would like to maintain the sunscreen which are used for the babies or for the pediatric age group is only the mineral oil sunscreens like zinc oxide or the titanium dioxide. We do not recommend using that SPF, which generally we use it for the adult age group.
Yeah. Interesting that you mentioned the outdoors and SPF. Is it that's what my next question is based on. Is it safe to take babies outdoors, especially when they have rashes? And then how do you protect them?
Yeah,
Babies
so
with.
yeah, so because of the eczema, we feel that for any particular skin condition, it's not right for the child not to visit outdoors. The child should be taken outdoors, but with the protection and with the precautions. So, if you are using a dermatologically tested skincare products which are can be applied just before going outdoors, they should be able to visit outdoors. Only thing is, what is to be taken care of is that the dust, the pollution, the sensitization can be limited, but the child should be covered basically with the exposed areas and apply good cleansers and creams or moisturizers before going outdoors. They can definitely go outdoors
Okay.
because all the senses develop when the children visit outdoors. So we do not want them to be indoors because of flaky skin or the eczema, because it can be treated. It may worsen a bit, but that shouldn't prevent you from going outside. That's not the issue.
Okay, Dr. Manisha, also, I want to understand, does, do skin rashes, do they also lead to sleep disturbances in children?
Definitely. So, no, as I told you, we're talking about this itch, scratch, itch cycle. So, because of them, and especially in the night times, what happens that the temperature becomes more colder, the temperature becomes more dry in the night times. The pollution, the dust, in the pediatric age group, we say they are more exposed to this sensitive, allergens. That is because they are closer to ground, right? The pediatric age group, not the newborn age group. And because of this, what happens is that even in all age groups, it's important to have a deep sleep time. And when you have these scratches and an itchy or a flaky skin, the child tends to keep scratching and has a topsy turvy in the bed. So, which is definitely can cause them a sleep disturbance.
Okay, Dr. Manisha, I'm also going to take one more parent question. Nisha asks, can clothes or towels trigger rashes? You did mention the fabric earlier.
Can trigger a rashes because if you are using something with the fragrance, or something with a strong detergent, this detergent, the molecules of that stay in the clothes. Okay, it's not that once you dry it's going to go away. The fragrance always stays, and if that touches the child, and if the child has sensitivity, it can trigger rashes.
Okay, and when should parents consider consulting a pediatrician or a professional for persistent rashes or patches?
Yeah, so as I told you, that is only when you have blisters, you have reddish patches, when you have oozing, and if a rash doesn't go away after 7 to 10 days of you applying a good moisturizer. And then the dermatologically tested, not the ones which are, which do not have a evidence-based safety profiles.
Okay,
I had
thank
one
you.
question. Somebody asked about the indoor heating. I think so.
Yes.
The
Yeah.
Yeah. So basically, we recommend the indoor heating for the babies who are premature or the babies who are in the newborn period. Okay, so we do recommend them. We do not recommend putting the indoor heater for the entire night. What you have to understand is that you can put it for about 1 or 2 hours, then they let the baby get adjusted to the normal this. Again, in the early mornings time, when you have too much of cold, that time you can re-switch on the heater. So please do not put it on the entire night. Then the skin becomes dry. It does cause dryness to the skin, even for the baby, because if it's a newborn baby, because we recommend this for generally babies who are newborn or small for the weight, the premature babies, and they themselves are covered very well with the cloth and 3-layer clothing. On top of that, if you put throughout the night heater, it can cause dry skin for them as well. Air conditioning, if there is no direct flow, you can, I suggest, on the air conditioner before one half an hour, and then you can take the child and put it to sleep, than putting the child to sleep and then on in the air conditioner. And make sure that you have checked the filters and cleaned it, because if it's season to season on in the air conditioner, it always requires servicing, I would say. So both of them are okay, but if we are using in moderation, but with the background that you have used a good moisturizer and covered the baby well.
Okay. All right. Thank you, Dr. Manisha, so much. This was really clear and practical guidance. Spotting skin issues, of course, early on can be challenging for parents, and you've helped us with the knowledge. With timely care, moms can keep their child's skin healthy, comfortable, and well protected, like you said. To all the parents who joined us today, thank you for your time, thank you for your patience, thank you for engaging so actively in this session. We hope today's workshop has helped you understand how to identify dry patches, flakes, rashes, and what simple steps can make a real difference in your baby's everyday comfort, like Dr. Manisha explained today. If your child's skin issues persist, become red or itchy, or you feel uncertain at any point, please consult your pediatrician or your pediatric dermatologist. Early attention helps prevent complications and keeps your baby happy. We appreciate your participation and look forward to having you in our upcoming sessions. Have a wonderful evening, everyone, and take care of yourself and your little one. Thank you, Dr. Manisha, for being here with us today.
Thank you, Masid.